Usual. Thanks everyone for bearing with us. So we're going to go ahead and get started with our COVID-19 information for this Wednesday. Dr. Moreno joins us from the Health Department. Good afternoon, Dr. Moreno.
Hi, Maya. Good afternoon. Here to take COVID-19 questions for public health.
Great. So if there is anyone who has questions for Dr. Moreno, go ahead and put your questions in chat. I am not seeing any. Well, gosh, I'm not seeing any questions in chat today. I know we started a little bit later than usual, but it's highly unusual. Any updates or information you might be able to share with us today while we're waiting for any questions?
No updates, Maya.
All right, so we will go ahead and let you go for the day. If people do come in and they have some additional questions, we'll be sure to pass them on to you for a response. So we're very happy to have some members of our county family, as well as friends at the Community Foundation, here to talk to us today to talk about the Vita program, which, as many of you may know, was renewed for funding for the end of the fiscal year. And they're going to share some of their successes about the program. So we're very pleased to have Krista Hani with our Health Department, as well as Michael Castro from the Community Foundation to talk about Vita. Good afternoon.
Good afternoon, Maya, and good afternoon to members of the public and to the media who are with us today. Michael, do you want to share your screen?
Yeah, I'll go ahead and do so right now. It might hiccup like I did last time. If it does, it takes about 45 seconds to go back on.
Okay, I have it on mine just in case we have any issues. Oh,
a hiccup, correct? Yeah. So let's give it a few seconds to catch back up. I don't know why this just started happening to me yesterday.
And while we wait for it to load, so we're presenting on Vita, the Virus Integrated Distribution of Aid project. And this project was first funded by the Board of Supervisors back in December of 2020 is when they approved that funding. And the funding came through the county to the Community Foundation. So Michael and I will be sharing together. We still don't see it, Michael.
It's really frozen on me.
Longer hiccup. It froze quite a while yesterday.
Okay,
there we go.
It came back online. Okay. There we go.
So if you go to the next slide. So Vita partners have worked tirelessly to create architecture for equitable change to reduce COVID-19 impacts in Monterey County. And we centered the project on the value of health equity. The Vita goal is to reduce COVID-19 disproportionate impacts. And those are impacts that are related to historic practices that led to inequities in the social determinants of health. Those are the conditions that surround us, that help us to make healthy choices and live healthier lives. And quite often it has to do with accessing services and various types of services that may or may not be around you or the infrastructure around you. And then that also are principles that underpin the project that are important are about accessibility, inclusion, and partnership. Next. So this is a bit of the timeline, but I also wanted to frame it around what system shifts we were working towards with Vita. So from testing and vaccine sites that are hard to access to ones that are easy for vulnerable populations to access. From misinformation spreading and confusion over changing guidance to the community health workers as the trusted sources of good and accurate information in their communities. And then from a safety net that had few community health workers to ones where community health workers have become trusted navigators. So while we were also working towards those system shifts, we had to be nimble to respond to the changing pandemic and the dynamics of it. So we did start with 125 community health workers once we were fully ramped up by March, with a lot of focus on that outreach and education and creating trust in the communities. And then we shifted more to vaccination supports by late spring. We also right-sized twice, once in June and again in September. And then in summertime, we began adding pop-up COVID testing to the community health worker activities, while we were also right-sized around 50 community health workers. And so, as I mentioned, outreach was a very important part of the project, as well as all that testing and vaccination supports. And we always focused on trying to reach communities, neighborhoods within the lowest quartile of the Healthy Places Index census tracts in our county. And on this map, this is documenting the numbers of interactions we've had. And the middle range to the darker blue are those census tracts where outreach was most concentrated. And those are communities that had the highest rates of COVID case rates originally in our county, as well as more disproportionate impact for mortality as well. Next slide. So I also mentioned, the pivoting with the dynamic. So the dynamic nature of that pandemic necessitated some quick strategy changes. Early on, as shown by the chart with the green bars, the strategy was developing the relationship with community through the education and communication around reducing exposure, protecting one's family. Mentioned we had over 390,000 interactions with the public since the project started. And then in summer, while continuing messaging and outreach, the chart with the orange and the brown bars, that shows how they began to implement outreach and supports for vaccinations, helping over 8,700 people get vaccinated directly, as shown by the orange bars. And then by late summer, we began to develop testing supports that allowed us to be there for the community during the Delta and then the Omicron surges. And just in January alone, helping 9,000 people with directly observed rapid antigen tests, of which over 28% were positive, and several hundred people were helped with isolation supports. And those are the darker brownish bars. So our county's COVID case rate in the summer was among the lowest in the state. Our peak case rate during the Omicron surge generally seems to have been lower than some of the neighboring counties. And we also have some very high vaccination rates for our county overall, but in particular in some of those Healthy Places Index lowest quartile census tracts. So we're not the main reasons for these really good outcomes in the county, but we are contributors along with many other players in the public health space. We started with the request by COPA to help break the chain of COVID transmission when they came to the board with the original ask. And to help those who were, for various circumstances, finding it hard to isolate and quarantine, the community health workers really helped by helping over 2,500 people with isolation or quarantine supports from February of last year to January of this year. And the data for those that we have complete data, the average age was 37 years old, 90% were Latinx, 57% were female, and 70% of the case management was done in Spanish. 95% of the individuals that reported completing isolation and quarantine successfully, and 95% of those that had their needs supported reported successful isolation as a result of their needs being supported. Now, food-related supports, as shown by the darker blue, have been important and continue to do so, but income replacement has grown to about 20% or more of those being held, attesting to the challenges community members still face. Those are the yellow part of the bars there. So now I'll hand it over to Michael Castro, my co-lead from Vita, from the Community Foundation.
Thank you, Krista. So these are some key Vita statistics, and I want to really bring your attention towards Vita has registered over 7,000 people in the community for vaccines. They've conducted over 21,000 rapid tests in the community, and they've had over 396,000 interactions with the community. Vita has been a very successful program. We have heard countless stories about the compassion and empathy Vita workers have for the community. One story that really stood out to me was a local Salinas resident that was hospitalized due to COVID. She was a single mother of two. The resident was referred to Vita through the county because she did not qualify for the county wage replacement program. She missed it by a single day. However, she was connected to one of the CHWs who referred her to the Action Council that was then able to get her wage replacement and food delivery to her children while she was in the hospital. The resident was in critical condition, on a ventilator, and could not speak. The BHC Vita team worked very closely with her to connect her to the needed resources, delivering the wage replacement funds and groceries to her home upon her hospital discharge. These key stats really represents thousands more of these individual stories. They're not just data point, but actual families and parents and children that have been helped. Asking for help is not an easy thing to do, but Vita's constant presence in the community has really helped break that barrier down. They've gained and earned the community's trust. It's important for Vita to always focus on quality improvement. We seek out new training opportunities, which are mandatory for the CHWs, and we host them in both Spanish and in English. Most of the trainings are directly related to COVID-19, but we do have offer a few that give the CHWs an overview of different programs and initiatives in the county. They have a lot of discussions with the community, since it's important that they have this, baseline knowledge of different programs available. The Vita leadership team has also been doing site visits as well to ensure the Vita team are running the sites efficiently and then safely as well. With the Omicron surge receding, now is really the time for Vita to make adjustments and be better prepared for the next variant or surge or even recovery. And as we look towards the future, we plan to have more cultural trainings about our Indigenous populations and preparing a social media misinformation series of trainings. This was a budget snapshot of the original grant that was given to Vita by the Board of Supervisors. We're on track to spend it down by March 31st. It was originally supposed to last only 6 months, but through the Community Foundation's due diligence and respect for the funds, it was able to last about 13 months instead.
So Michael and I are presenting to you today this PowerPoint, which we presented yesterday to the Board of Supervisors. We were asked to come back through the referral process to present on how much it would cost to continue Vita at current capacity through December of this year. And that total is $1.57 million. But as you can see, matched by other funding, we have the federal health literacy grant funds, as well as there's some funds from the Community Foundation. And we had a funding source potential for it. Department of Social Services, the health department reached out to them, and they proposed that we could use some of the unspent ARPA funds from the Great Plates Delivered program that had been an allocation to Department of Social Services, and those funds could be transferred over to the health department to then use to do this, match this, to meet this funding request that we had. Also, we did mention yesterday that coming down from the state will be this opportunity through Medi-Cal to have community health worker services as a covered Medi-Cal benefit. There's a lot to be developed there. The state is sort of building that plane as they're starting to fly it. Exciting though, because we are one of, I think, that will be the 6th state in the United States that will have community health workers covered under Medi-Cal, or at least for us, Medi-Cal, Medicaid for the federal other states. And then we'll be working with the organizations to see how we can support them as that is potential transition opportunity for community health workers, for other jobs for them down the road, and then to continue the important work that they've been doing connecting people to services to improve their health outcomes. Next slide.
So COVID-19 has really been an unpredictable virus. There's not a lot that we can be sure about, but it's likely there's going to be new variants and possibly new surges. Vita CHWs have really evolved with the pandemic, adjusting to be able to provide the services the community needs at that moment. As we plan for the future, there are a few things that are at the top of our mind. Vita complements the governor's smarter plan of living with the virus, but being prepared for it. We need to continue to bring in our booster and pediatric vaccines number up, especially once the under 5 vaccines are approved. Vita will continue to operate its clinics and support the mobile vaccine testing van that goes directly to underserved populations. I understand, we're really ready to move past this, but we still need to be prepared. Part of our work going forward will always be about those system shifts we've talked about. So this slide right here shows the county's original investment, the $4.9 million that started the Vita program. But because of that initial investment, other outside funds were brought into about $5.6 million. So about 125% of the funds have been matched, bringing outside dollars back into the program.
So normally the thank you is at the end, but we wanted to put it before we actually got to the ask of the Board of Supervisors. And that's because Vita wouldn't be possible without all the many partners that we do have as part of the project. From the Board of Supervisors to actually, there was 3 of us that helped co-lead it originally with Rosemary Soto with the CAO's office, who's now stepping away to work on other special projects that are very important for the county. And then also all of the Vita community-based organizations, and then just some of the collaborators that we've had over the past year. There's even more to add to this, but it really, they brought in everything from First Five, giving us books, diapers, and wipes, and the Alliance with gift cards for people who are getting vaccinated at the pop-up clinics. And even recently, the state, we were able to get a taco truck at one of the pop-up clinics, and we hope to get more and more potential. So again, just a huge thank you that goes out to everybody for the support that we've received for this great project, but then especially for all the community health workers who really did work tirelessly over the past year on really reaching the communities and contributing to our improved COVID-19 case rates and our vaccination rates and our testing rates in the county. And so the good news was that the board did approve the reallocation of that funding, the ARPA funding, and to continue Vita through December of 2022. And they want us to be careful with the funds and to come back with quarterly check-in reports, a status on the project, and also a sustainability plan to look at how those other opportunities that we mentioned are being integrated into the work of Vita. And that would be including the Medi-Cal benefits option for community health workers. So we're happy to take any questions.
Thank you very much, Krista and Michael, for that really great, thorough look at Vita. I think people Vita became part of our conversation, but people may not know really how deeply they began to work in the community. I'm not seeing any questions in chat, but I do have a question. I'm wondering, over the time that Vita has been in operation, it has expanded, it's contracted. What have we learned from using Vita in these communities? What have we learned about reaching certain communities who may not otherwise be willing to get information from the county about health or any other issue?
We've definitely learned the importance of having, where community health workers, the model is that it's more peer-to-peer, and people are from the community. And so they may be already a trusted member of the community. And also, if a member of the community is needing help or access, when somebody who's from your community talks to you, they're talking about the services that are around you, what may be nearby, and also potentially it might be in the language that you need. There was one example, it was in even in the article that the Weekly did, but where we have community health workers who speak multiple languages. And so one of them was at a site where she could tell somebody was having trouble asking questions in Spanish, and heard her speak, thought potentially in the language that the other language she spoke, which was Mixteco, and went over to talk to them. And the person was concerned about the vaccinations, and so was able to talk to her in Mixteco to allay her concerns and then help her get her family registered to get vaccinated. And then later, because of having made that connection, when other members of the household became positive for COVID, they reached back out to that community health worker specifically. So that relationship had developed, and they felt comfortable to reach out where they may not have wanted to reach out to an agency for help.
I do have a question that came in for you. How many community health workers does Vita have right now?
We have 50 part-time and full-time community health workers. And then we also do have a community health worker coordinators and some data analysts that are very important part of the project and help us with the work on the ground and coordinating the community health workers with each of the organizations. And several of them are doing community health work as well.
Thank you. And that was the only question I had for you. Your presentation was really thorough and so encouraging and so uplifting to see all the positive things that have happened with Vita during the time that it's been in operation.
Oh, thank you, Mayor.
Thank you so much.
Thank you for sharing this today. And I know you shared it last night. Thanks for a redo. And so now we'll go on to our last topic, a very important topic. We're looking ahead to next Tuesday on March 15th. Several Monterey County water agencies will be coming together to hold a public forum on regional water issues in northern Monterey County, including issues of supplies and solutions for overdraft areas. Everyone is encouraged to listen or participate in this forum, and joining us to talk about what is ahead. A little preview of some of the discussions are folks that are involved in the forum. We have Brent Buki, who's with our Monterey County Water Resources Agency, and Donna Myers, who's the General Manager for Salinas Valley Basin Groundwater Sustainability Agency. But we're also very pleased to have 5th District Supervisor Mary Adams, who is leading the charge on this forum. And Mary, I was hoping you might start off with a little bit about how this came together and why we're doing this now.
Thank you very much, Maya, and thank you, Brent and Donna, both for being here with me today. This coming Tuesday, March 15th, at 1:30 during the regular board meeting, we're going to be holding the board's first regional water forum. We've planned a series of 3 different conversations about water supply issues this year. The Regional Water Forum is the outcome of a board referral that I made last fall. I saw a need for the board and our water management agencies and many stakeholders to have a more thorough, comprehensive, and common understanding of our water supply issues. I've always advocated for a regional solution for our water problems, and we need to expand the understanding of water problems in other areas of the county, in addition to the Monterey Peninsula, if we want to have any hope of a regional solution and the dialogue that is needed to make that happen. The discussion that we're planning for next week is driven by a new state law, the Sustainable Groundwater Management Act, which has the acronym of SGMA, S-G-M-A. Because of this new state law, we have formed 2 new agencies, the Salinas Valley Basin Groundwater Sustainability Agency and the Marina Coast Water District Sustainable Groundwater Agency. We also have 2 longtime partners in northern Monterey County, our Monterey County Water Resources Agency and Monterey One Water, who have been recycling water for, gosh, now just some decades, just really to great acclaim. We have asked these 4 agencies to put together a presentation for this coming Tuesday. The presentation is going to take a look at the last 75 years of water infrastructure assets in Monterey County and what a 21st century water system could look like. It will also examine water use and how our economy is tied to water. Recognize that most of my district includes the Monterey Peninsula, which has been the focus of many discussions, lawsuits, and perhaps where the saying "liquor is for fighting" started. Presentation on the Pure Water Monterey project and expansion that will address the needs in the peninsula. Next week, the areas that we're going to be talking about, though, include the eastern part of my district from Lorella's Grade east to River Road, and then along the Highway 68 corridor. And we'll be talking about Marina and the former Fort Ord. These areas are the Monterey sub-basin under SGMA, that new act. The presentations also include 3 other sub-basins under SGMA in the Salinas Valley, and that's the 18400 Aquifer, the East Side, and the Prunedale area, commonly called Langley. Our community has been able to successfully implement regional water projects, and we should recognize our accomplishments with recycled water and also see where we need to do more. I'm looking forward to restarting a regional dialogue about water next week with some fresh perspective, and I hope the community will join in. And with that today, as I mentioned, I am happy to have 2 key players in the Monterey County water world, Brent Buki, who's General Manager of the Monterey County Water Resources Agency, and Donna Myers, the General Manager of the Salinas Valley Groundwater Basin Agency. Along with my Chief of Staff, Sarah Hardgrave, they have been instrumental in developing the forum and they'll be able to answer any questions and add perspective as well. So that's a little bit of an overview, Matt, and I hope that that's what you were looking for.
Oh, that was a fantastic overview and giving people a chance to know what the forum is going to be about, especially if they live in those specific areas. They may really want to hear what people have to say. I'm hoping that Brent and Donna, you might give us a little bit of a preview of some of the information that you'll be sharing at the forum. And Brent, because you're a fellow county employee, I'm going to tap you first to maybe share a little.
Okay, great. Thank you. So I am Brent Buki, General Manager of the Monterey County Water Resource Agency. And as Supervisor Adams just pointed out, she has been a proponent for regional water solution for as long as I've known her. And I've worked really hard with our sister agencies, as Supervisor pointed out, Monterey One Water and Marina Coast, and obviously with Donna Myers over at the Salinas Valley Basin GSA. We meet regularly, all of us, whether it's together as a group or individual groups. And we are looking for solutions because water is life. And that's what Water Resource Agency is working on every single day. And so are these other entities. And there are impacts for a lack of water in the air, in the county. And so working together to come up with a regional solution is what we need to do.
Thank you very much, Brent. Donna, can you add on to what Brent was saying?
Absolutely. And thank you, everyone, and nice to meet you all. Yeah, the Salinas Valley Groundwater Basin Agency, Sustainability Agency, is really sort of the new water kid on the block in a sense. We represent a new California law that was passed in 2017, which is the first time that the state of California has actually regulated groundwater, and has basically instituted a regulatory program whereby local communities develop groundwater plans to address problems that may be existing within the basin, and then need to actually chart a course in those plans to accomplish 6 sustainability criteria for their basins. So much of water development and water management in most communities in California have oftentimes been about finding water, trying to find water to either serve communities, businesses, agriculture, etc. This is the first law where we're required as a community organization to really work with individual stakeholders throughout our region to identify the issues that exist within the groundwater supply sources, and then work with them on trying to figure out ways to remedy and bring the basins into sustainability. So it's very much a locally driven process. It's meant to be done by the local community folks who are using the groundwater source, but the state realizes that all communities must develop a sustainability plan for that resource, especially as climate change continues and we start to see these extended droughts. Groundwater becomes one of the, if not the most important resource in California, most likely than almost anything else. So as Brent said, water is life. Brent's agency has a long history of managing the groundwater resources. We're sort of a companion or sister agency, and we bring that perspective of really needing to bring the basins into a sustainable condition in the next 20 years. So moving a little bit away from finding more sources of water or using water in different ways, and really more towards acknowledging that we must preserve and sustain these resources for all populations moving, all future generations moving ahead. So that's kind of our perspective that we'll be bringing to the forum. And we'll be providing a technical update on the conditions of the groundwater basins that we have studied over the last 3 years and written these stakeholder-based plans with. And so we'll provide an insight into what I like to say, sort of the mystery of our groundwater basins and our groundwater resources. And we'll share a little bit about the kinds of things that we think are going to need to be done with the community over the next 20 years to maintain these important resources.
Thank you very much, Donna. And thanks also for adding about what we all can do. It's not just finding the water, but we all have a role to play in this. And I think we're all becoming more and more sensitized to climate change and, changes in the water available to us. So I'm hoping everyone will participate. And Mary, I'll go ahead and share again that this will be part of our next board meeting next Tuesday at 1:30 in the afternoon. If you've participated in board meetings before, you can use the same participant code, and that code will also be posted if you're participating, say, on Facebook or YouTube. That will be posted there as well for you to be able to click or call in. Any last words, Supervisor Adams, on the forum?
Well, we also are going to be, since it's the board meeting, we are going to be live. So if people choose to, they can join us in person as well as via Zoom, etc.
Thank you for reminding me we can be in person. Any questions for any of our presenters on the water forum today? It was a very thorough explanation of what's ahead, and we'll put the link more about the meeting in the chat portion on social media for those who want to follow.
Thank you.
No questions? Then that will wrap up our briefing today. Thanks everyone for sharing information today. It was very interesting. Our next briefing will be next week, and we'll see you then.
Thank
Thank
you,
you.
everyone.
Bye.
Bye-bye.
Bye.